lipid-lowering agents and anti-Parkinson's drugs outline, we're going to be talking about the different types of cholesterol to really understand certain disease processes that is affected by our cholesterol levels. So triglycerides. Triglyceride is basically a type of cholesterol that's coming from our dietary intake. So typically a patient or a person that eats a lot of carbohydrates can actually end up with high triglyceride levels. Anyway, the main idea is triglyceride is from your diet. Then it, gets digested, it goes to the bloodstream. What happens then is that the cholesterol is broken into different types of cholesterol. Now you have the LDL and HDL. So LDL basically is metabolized. So once the cholesterol is broken down, some of it becomes LDL. Unfortunately, LDL gets deposited in the blood vessel, causing some plaque buildup. On the other hand, another particle that is basically coming from that cholesterol is HDL. So HDL, on the other hand, is actually good for you. So HDL transports the cholesterol from the blood vessels to the liver so that we can actually get rid of it. So I think about the HDL as your garbage truck or your garbage collector. So the more HDL you have, the easier it is to get rid of the bad cholesterol. So this is another illustration that hopefully is going to help you understand the differences between LDL and HDL. So the bad is the LDL that can lead to accumulation in the arteries, causing some blockages, leading to coronary artery disease. So you can see over here. And then HDL is basically your good cholesterol. It helps regulate the storage of LDL and promotes its removal. Hyperlipidemia or high cholesterol levels. So this is a condition wherein a person has elevated cholesterol levels. So this can vary. It can be your total cholesterol or just the LDL alone, triglycerides, and you also have component is your HDL. And as we talked about earlier, that's your good cholesterol. Anyhow, so occasionally some patients may need to have their blood work done because we want to look at their cholesterol profile or lipid profile. So the general recommendation is for a patient to have a total cholesterol level of less than 200, and HDL or high density lipoprotein for male should be above 50, and for female it should be above 60, and for LDL or low density lipoprotein should be less than 120 for both male and female. But actually now the recommendation is less than 100, so even better, right? But for the purposes of this course, it's enough to know that it needs to be less than 120. But heads up, you may see some other literature stating that it needs to be less than 100. Now triglyceride should be less than 150. Next, we're going to talk about Parkinson's disease. So please turn your outline page to page 6. So Parkinson's disease is a degenerative disorder of the central nervous system. And when we say degenerative, typically it means that over time it continues to progress or worsen. And most of these degenerative diseases are actually irreversible. And typically, again, it usually will progress. So this happens when neurons that produce the neurotransmitter dopamine actually die. And then so it causes muscle movements to be disorganized. And so the lack of dopamine and the increase in acetylcholine causes tremors, slow movement, rigid muscles, and balance problems. So it has to do with their movement coordination. So again, it's a degenerative disease of the central nervous system causing the death of neurons that produce dopamine. And as we talked about previously, right, dopamine is very important, especially when it comes to our movement and coordination. So we typically see Parkinson's in people age 50 and older. And then, or older than 50, it's more common among men, but there has been cases of women and as well as individuals who are younger than 50 years old. So typically when you look at your patient who has Parkinson's disease, especially as they continue to progress, you will see a lot of tremors, muscle rigidity, so meaning it's hard, they have a hard time moving, bradykinesia. So bradykinesia is the slow movement of the patient. So like when they're walking, it's taking them such a long time to kind of do what they're supposed to do. And then postural instability, so these patients are going to be at risk for falling. In addition to that, when you think about the influence of dopamine, it's one of the feel good neurotransmitters, right? And so if you have neurons that are dying that produce dopamine, now you have lower dopamine levels. So what happens when dopamine levels are down? It can actually affect your mood and mentation. So it can lead to anxiety, depression, and dementia. So this illustration right here is basically a classic manifestation of Parkinson's. So they have this mask-like facial expression. They usually are soft spoken, and towards the end of the disease, as they progress, we may have a hard time understanding them when they speak. You may see them drooling and having a hard time swallowing. You will see hand tremors even at rest. They may be constipated often. They may be urinating often, and they have a hard time with the movement. And so they start kind of like shuffling, really like short steps. And again, towards the end, they may not be able to move at all because their coordination is just really disorganized and really bad. And like I said, unfortunately, there's really no cure for this. We can actually control their symptoms, maybe delay the progression of the disease, prevent some complications, but for the most part, this disease is degenerative and progressive. Hoping that one day we can actually find a cure or prevent this disease from happening. I know that there are some studies actually that's linking Parkinson's disease to certain ingredients from different types of sodas. I can't remember it on top of my head, but anyway, so I mean, if we can find those causes and hopefully prevent people from developing it, that would be great, because again, this is very detrimental, and it's very sad when we see people who are otherwise before very active and healthy start deteriorating. And again, it does affect their speech, and so then it worsens their anxiety and depression when they can't express themselves. Anyway, so we're going to be talking about the disease processes, the medications that we use to treat this disease processes. But it's very important to kind of have an idea of these diseases that we are treating.